Thanks, Patrick. All right, we're talking about lung cancer and treatment here. Joining me now is Dr. Suman Rao. She is the Director of Thoracic Oncology at MedStar Health. Doctor, thanks so much for coming back in.
Thank you for having me here.
We're hearing a lot about immunotherapy. Is that something, first of all, what is it, and how is it used to treat lung cancer?
So immunotherapy is very different than chemotherapy and radiation. So these are drugs that actually activate the patient's own immune system to become active against the cancer. It potentiates it. So these are drugs that are given intravenously, just like chemotherapy, but they do not have the dreaded side effects of nausea, vomiting, or hair loss. So they're much better tolerated in general.
So is it widely available, and is everyone a candidate for it?
So anybody with stage 3 and 4 non-small cell lung cancer should look into getting immunotherapy. They should be widely available. It is used pretty commonly now. For small cell lung cancer for stage 4, it is also approved.
So talk to us about some of the other treatment options that are available. Have there been any groundbreaking therapies or treatments for lung cancer if you don't want to go the surgery route?
Yeah, so besides immunotherapy, so there is stereotactic radiation therapy for lung cancer. So these are for patients who have small lung cancers who are not candidates for surgery or really do not want to go through surgery. So that has been very much of a development recently. Also, we're looking at genes within cancer cells, and this has become a big field. We know more genes that drive the cancer, so to speak. These are genes that cause the cells to grow, and so we are finding more and more drugs that can block these genes and become effective in treatment of cancer.
Experts standing by to take your calls. The number is 410-671-0702. One last question for you, Dr. Rao. Clinical trials, is that something that's an option for somebody who's lung cancer?
Absolutely, at every stage. I think patients should look into clinical trials. They should ask their doctor about clinical trials. And there are multiple websites that are available. For instance, MedStar Health has our own portal and website that describes clinical trial options. You can also go on the NCI website and look for trial options.
All right, Dr. Rao, thank you very much for joining us. Always very, very good information.